and, running medialward, is inserted into the central tendinous point of the perineum, joining in this situation with the muscle of the opposite side, with the sphincter ani externus behind, and with the bulbo cavernosus in front. In some cases the fibers of the deeper layer of the sphincter ani externus decussate in front of the anus and are continued into this muscle. Occasionally it gives off fibers which join with the bulbo cavernosus of the same side. Variations are numerous. It may be absent or double, or insert into the bulbo cavernosus or external sphincter. Actions. The simultaneous contraction of the two muscles serves to fix the central tendinous point of the perineum. The bulbo cavernosus, ejaculator urinae, accelerator urinae, is placed in the middle line of the perineum, in front of the anus. It consists of two symmetrical parts, united along the median line by a tendinous raphe. It arises from the central tendinous point of the perineum and from the median raphe in front. Its fibers diverge like the barbs of a quill pen. The most posterior form a thin layer, which is lost on the inferior fascia of the urogenital diaphragm. The middle fibers encircle the bulb and adjacent parts of the corpus cavernosum urethrae, and join with the fibers of the opposite side on the upper part of the corpus cavernosum urethrae, in a strong aponeurosis. The anterior fibers spread out over the side of the corpus cavernosum penis, to be inserted partly into that body, anterior to the ischio cavernosus, occasionally extending to the pubis, and partly ending in a tendinous expansion which covers the dorsal vessels of the penis. The latter fibers are best seen by dividing the muscle longitudinally, and reflecting it from the surface of the corpus cavernosum urethrae. Actions. This muscle serves to empty the canal of the urethra after the bladder has expelled its contents. During the greater part of the act of micturition its fibers are relaxed, and it only comes into action at the end of the process. The middle fibers are supposed by Krause to assist in the erection of the corpus cavernosum urethrae by compressing the erectile tissue of the bulb. The anterior fibers, according to Terrell, also contribute to the erection of the penis by compressing the deep dorsal vein of the penis as they are inserted into, and continuous with, the fascia of the penis. The ischio cavernosus, erector penis, covers the crus penis. It is an elongated muscle, broader in the middle than at either end, and situated on the lateral boundary of the perineum. It arises by tendinous and fleshy fibers from the inner surface of the tuberosity of the ischium behind the crus penis, and from the rami of the pubis and ischium on either side of the crus. From these points fleshy fibers succeed and end in an aponeurosis which is inserted into the sides and under surface of the crus penis. Action. The ischio cavernosus compresses the crus penis, and retards the return of the blood through the veins, and thus serves to maintain the organ erect. Between the muscles just examined a triangular space exists, bounded medially by the bulbo cavernosus, laterally by the ischio cavernosus, and behind by the transversus perineae superficialis. The floor is formed by the inferior fascia of the urogenital diaphragm. Running from behind forward in the space are the posterior scrotal vessels and nerves, and the perineal branch of the posterior femoral cutaneous nerve. The transverse perineal artery courses along its posterior boundary on the transversus perineae superficialis. The deep fascia. The deep fascia of the urogenital region forms an investment for the transversus perineae profundus and the sphincter urethrae membranaceae. But within it lie also the deep vessels and nerves of this part, the whole forming a transverse septum, which is known as the urogenital diaphragm. From its shape it is usually termed the triangular ligament, and is stretched almost horizontally across the pubic arch, so as to close, in the front part, the outlet of the pelvis. It consists of two dense membranous laminae, which are united along their posterior borders, but are separated in front by intervening structures. The superficial of these two layers, the inferior fascia of the urogenital diaphragm, is triangular in shape, and about 4 cm in depth. Its apex is directed forward, and is separated from the arcuate pubic ligament by an oval opening for the transmission of the deep dorsal vein of the penis. Its lateral margins are attached on either side to the inferior rami of the pubis and ischium, above the crus penis. Its base is directed toward the rectum, and connected to the central tendinous point of the perineum. It is continuous with the deep layer of the superficial fascia behind the transversus perineae superficialis, and with the inferior layer of the diaphragmatic part of the pelvic fascia. It is perforated, about 2.5 cm below the symphysis pubis, by the urethra, the aperture for which is circular and about 6 mm in diameter, by the arteries to the bulb and the ducts of the bulbourethral glands close to the urethral orifice, by the deep arteries of the penis, one on either side, close to the pubic arch, and about halfway along the attached margin of the fascia, by the dorsal arteries and nerves of the penis near the apex of the fascia. Its base is also perforated by the perineal vessels and nerves, while between its apex and the arcuate pubic ligament, the deep dorsal vein of the penis passes upward into the pelvis. If the inferior fascia of the urogenital diaphragm be detached on either side, the following structures will be seen between it and the superior fascia: the deep dorsal vein of the penis, the membranous portion of the urethra, the transversus perineae profundus and sphincter urethrae membranaceae muscles, the bulbourethral glands and their ducts, the pudendal vessels and dorsal nerves of the penis, the arteries and nerves of the urethral bulb, and a plexus of veins. The superior fascia of the urogenital diaphragm is continuous with the obturator fascia and stretches across the pubic arch. If the obturator fascia be traced medially after leaving the obturator internus muscle, it will be found attached by some of its deeper or anterior fibers to the inner margin of the pubic arch, while its superficial or posterior fibers pass over this attachment to become continuous with the superior fascia of the urogenital diaphragm. Behind, this layer of the fascia is continuous with the inferior fascia and with the fascia of Colles. In front it is continuous with the fascial sheath of the prostate, and is fused with the inferior fascia to form the transverse ligament of the pelvis. The transversus perineae profundus arises from the inferior rami of the ischium and runs to the median line, where it interlaces in a tendinous raphe with its fellow of the opposite side. It lies in the same plane as the sphincter urethrae membranaceae. Formerly the two muscles were described together as the constrictor urethrae. The sphincter urethrae membranaceae surrounds the whole length of the membranous portion of the urethra, and is enclosed in the fascia of the urogenital diaphragm. Its external fibers arise from the junction of the inferior rami of the pubis and ischium to the extent of 1.25 to 2 cm, and from the neighboring fascia. They arch across the front of the urethra and bulbourethral glands, pass around the urethra, and behind it unite with the muscle of the opposite side by means of a tendinous raphe. Its innermost fibers form a continuous circular investment for the membranous urethra. Nerve supply. The perineal branch of the pudendal nerve supplies this group of muscles. Actions. The muscles of both sides act together as a sphincter, compressing the membranous portion of the urethra. During the transmission of fluids, they, like the bulbocavernosus, are relaxed, and only come into action at the end of the process to eject the last drops of the fluid. 2b. The muscles of the urogenital region in the female. Transversus perineae superficialis, bulbocavernosus, ischiocavernosus, transversus perineae profundus, sphincter urethrae membranaceae. The transversus perineae superficialis, transversus perineae, superficial transverse perineal muscle, in the female is a narrow muscular slip, which arises by a small tendon from the inner and fore part of the tuberosity of the ischium, and is inserted into the central tendinous point of the perineum, joining in this situation with the muscle of the opposite side.